Hello and welcome to my channel Passionate PT. Today we're going to discuss about types of bladder in spinal cord injury patients. So let's start. Before going into detail the types of bladder and how a bladder can be affected in a spinal cord injury patient, we need to understand the normal phenomena of avoiding the normal phenomena of micturition or urination, that is called as micturition reflex. So here I have made a sketch where I'll try to make you people understand that how does the normal micturition reflex works. So here it is the urinary bladder, this is the spinal cord, and here's the brain. So what happens that when bladder gets filled with the fluid, or bladder is filled with the urine, it stretches on its walls. That means, as you know, bladder is made up of a muscle, that is detrusor muscle. So when the fluid is filled in it, the bladder is stretched. From there the signals are transmitted, or the action potential. The more the bladder, the more the bladder is filled, the more the signals will be transmitted to the spinal cord. And which levels of spinal cord are involved in controlling the micturition reflex, that are S2, S3 and S4. These three sacral levels, they control the micturition reflex. So the signals travel from the bladder towards the sacral levels of the spinal cord. From here, the spinal cord activates the parasympathetic nervous system and tell the bladder to release the urine or urinate. But what happens that in addition to signals going to the sacral levels of the spinal cord, signal also travels upward and go towards the brain, or more specifically towards pons and cerebrum. From there, the brain decides that whether it is suitable for the person to urinate at this moment or not. For example, if you are in middle of something, like you are in a classroom, or you are in some sort of a meeting where it's not possible for you to go to the suitable place, so at that time brain sends back the signal and tells the bladder to not to urinate. That means it sends signals to block the micturition reflex. In addition to blocking the micturition reflex, what it does, the signals also travel to external urethral sphincter and keep it contracted and keep it shut, because the external urethral sphincter is something that is almost under the voluntary control. So it keeps that sphincter shut and does not allow the urine to come out of the bladder. So this is how normal micturition reflex works in all the normal individuals. Now what happens that when a patient has spinal cord injury, then the functioning of bladder can be changed. Like what can happen that when there is injury at any level of the spinal cord, so the type of the bladder that will result from that injury will depend on the level of the injury. Like the bladder can be upper motor neuron, or bladder can be of lower motor neuron type. The upper motor neuron type of the bladder is spastic and reflexive, and the lower motor neuron type of the bladder will be flaccid and areflexive. Now how we will find that whether the bladder is upper motor neuron or lower motor neuron, this will depend on the neurological level. If the injury is above the sacral level, then for the sacral level it will be upper motor neuron type bladder, and if the injury is through the sacral level, or if the injury is through the sacral level, then it will be lower motor neuron level, or if the injury is below, then that depends on the level of injury again. So by the level of the injury, it is decided that what type of the bladder will result after the injury. I have described in detail in my previous video about upper motor neuron and lower motor neuron types. Please watch that video. It will be really easy for you to understand here. So as the sacral levels control the micturition reflex, so any injury through the lumbar level or above will result into the upper motor neuron type of the bladder, or any injury through the sacral level will result in the lower motor neuron. Now what we mean by upper and lower motor neuron? When the resulting bladder is upper motor neuron type, it will be spastic and reflexive. Now what is meant by spastic and reflexive? That means that the muscle, the trusser muscle, will be spastic as the fluid will be filled in it. It will not stretch to accommodate the increasing fluid in it. So it will not accommodate extra urine or extra fluid coming from the kidney, and it will release the urine as soon as even a small amount of urine has collected. And reflexive mean that as soon as the urine will come to the bladder, it will release it. That is upper motor neuron. Now lower motor neuron includes the flaccid type of the bladder. That means the bladder will become flaccid. It will keep on accommodating, accumulating the urine, and it will not contract, or it will not push itself. It will not compress or contract itself to release the urine. That is flaccid, and that means it will not have the reflex, it will not have the micturition reflex to release the urine, right? So for upper motor neuron, that cannot accommodate the urine, that cannot accumulate the urine, and lower motor neuron type cannot release the urine. Okay, so these are two type of the bladder. Now there is another thing, that is external urethral sphincter. External urethral sphincter is something different from the type of the bladder. Like if the bladder is spastic, that does not give you a surety that the external urethral sphincter will also be spastic. It can be flaccid or spastic. Similarly, if bladder is flaccid, external urethral sphincter can again be the flaccid or spastic. Okay, so now as the spinal cord injury patient has to be given the catheter of some type if he has lost control, or if he has reduced control on his urine output. So what will there are different types of the catheter that are given, but the type of catheter that is given is mainly dependent on the type of external urethral or external urinary sphincter patient is having. Like if the sphincter can be spastic or flaccid. If the sphincter is flaccid, that means that the sphincter is not under control of the patient, and as soon as the urine will come to the bladder, it will come out of the sphincter, because the sphincter is flaccid and is not tight enough to hold on to the urine. Okay, and if the sphincter is spastic, that means that no matter how much of the urine has collected into the bladder, it will not relax, it will remain spastic, and it will not let the urine out. Okay, and type of the sphincter is mostly determined by urodynamic studies. After the study, they come to know that which type of the sphincter we have, and depending upon the type of the sphincter, the type of the catheter is chosen for the patient. Okay, now what are the types of the catheter? There is indwelling catheter, intermittent catheter, suprapubic and condom catheter. Two most common catheter being the indwelling and intermittent catheter. Now, indwelling catheter is mostly used in the patient with the flaccid external urethral sphincter, because indwelling catheter, you must be aware, are the normal type of the catheter that are used in mostly even in the other surgical patient, where the it is inserted into the urinary into the urethra, external urethral sphincter in the urethra, and a bag is attached in which the urine is collected. So that is the indwelling catheter. Okay, so indwelling catheter is mostly used for the patient with flaccid external urethral sphincter. Okay, because the patient with a flaccid sphincter do not have a control on their external urethral sphincter, and as soon as the urine will be collected into the bladder, it will come out of the bladder, no matter bladder is spastic or flaccid, because the it's the external urinary sphincter that controls the exit of the urine. The next type is intermittent catheter. This type of the catheter is preferred if possible for the patient. Like, this makes the patient independent. It does not require a bag. It is a catheter that is given to the patient, and whenever the patient feels to urinate, the patient goes to the washroom and place this catheter and release the urine out of the bladder. So intermittent catheter is mostly given to the patient with the spastic external urethral sphincter, because that sphincter will not allow the urine to come out no matter how much has been collected. So so the patient can go and place the catheter and stimulates the bladder by suprapubic hair pulling or tapping the bladder, and suprapubic tapping the bladder, or even sometimes if the bladder is flaccid, they can stimulate it by increasing the abdominal pressure. By increasing that, they stimulate the bladder, and then through intermittent catheter they can release it. So indwelling catheter is used with the flaccid external urethral sphincter, intermittent with the spastic. Okay, indwelling, it also depends on the person you are recommending it. Indwelling is also used in children, in very old age patient, or patient who are mentally disturbed, who cannot handle themselves. In those patients we recommend indwelling. Other two types are not that common, that is suprapubic catheter. In this, if there is any problem with the urethra, there is any infection, tumor or stricture or anything that is present, then suprapubic catheter is used, and condom catheter is used into the male patients. Mostly they just put it like a condom on them, and this is mostly used for aged patients who cannot again handle the other two types. So that is why in them condom catheter is used. So this is all about types of bladder and types of catheter we recommend to the patient. After we come to know, and this is mostly decision is made after urodynamic studies, which tell about the type of the external urethral sphincter, external urinary sphincter the patient is having. Till the urodynamic studies, indwelling catheter is always preferred. Okay, so this is all about types of bladder and types of catheter. Thank you so much. Okay, take care.